Good morning, good afternoon, evening, everybody. So we're really glad that you could join this webinar and to find you in this virtual room with us. My name is Zeinab Hijazi. I'm the Senior Mental Health Technical Advisor with UNICEF based in New York. And I will be moderating today's session with my dear colleague, Liliana Carvajal, who's a data and analytics expert focused on MHPSS as well. Liliana, I don't know if you want to say anything or...
Hi, everybody. Thanks for joining us. Even though it was random, we're very happy to have you. We will be having fun here with this presentation, and we will have some activities that are of some interactive nature. So we're gonna be asking you to go onto another link. We will provide the link in the chat box for you to go and make your assessments and make some decisions there. But it will be fun. Thank you.
Thanks, Liliana. And next slide, please. Today we will provide you with an overview of how UNICEF's global MHPSS programming framework builds upon the IASC Common M&E framework, recognizing that monitoring, evaluation, accountability, and learning systems for MHPSS programs are a must and should examine not only basic outputs such as beneficiaries reached, facilities supported, and skills gained, but also measure outcomes such as attitudes and psychological well-being, and when possible, long-term impact. So throughout the presentation, we will reference where and how the meal component of the UNICEF framework and the IASC M&E framework converge. The second part of the session today will be practical in nature and engage you in applying the IASC M&E framework to UNICEF's Adolescent Mental Health and Suicide Prevention project in Kazakhstan, which essentially takes place through integration of MHPSS in education and health systems. So really looking forward to engaging you around that project. Next slide, please.
Do you see the next slide?
Yep. Yes, my screen was freezing. It's still on the first one. Okay, thank you. I see it now. Let us start quickly by introducing you to the UNICEF Global Multi-Sectoral MHPSS Programming Framework, which is essentially this unifying operational framework for integrating MHPSS for children and caregivers across sectors in regional and country level strategies and action plans. And the framework, essentially what it does is it recommends actions and strategies through intervention tables that scope all sectors within the socio-ecological model. It includes a theory of change for a shared framing and approach across sectors and settings. It is child and adolescent focused. It is operational, kind of blending the theoretical and practical guidance on community-based MHPSS. And it addresses key gaps in child and adolescent MHPSS policy, legislation, financing. And very importantly, and very relevant for our conversation today, it includes a meal component, monitoring, evaluation, accountability, and learning that is essentially informed by the IASC Common M&E framework, which has launched today. And essentially through the meal system and through the meal component within the operational guidelines, it essentially supports in the design and development of monitoring and evaluation systems and structures for MHPSS programming that are specific to children and families at UNICEF. And with that, I hand over to Liliana to walk us through what this means and how did we in fact use the IASC document to shape our institutional guidance for setting up an effective meal system, and one that is child and youth focused. Over to you, Liliana.
Thank you, Zeinab. So as you clearly said, for the creation of the UNICEF framework, we had adapted the outcomes in the IASC M&E framework to be specific for children, adolescents who are like the target population, the main target population for UNICEF, and all of that in the alignment of the theories of change for social ecological models, which some of you might be familiar with. As part of this, the common M&E framework from the IASC is the foundation for our UNICEF log frames, which are rooted in UNICEF's theory of change, which is composed of the pillars that Zeinab just mentioned in terms of the 4 outcomes. And so we wanted to be aligned with shared language and concepts in terms of the application of the intervention pyramid and the community focus and person focus approaches, the two parts of of the framework. UNICEF framework also direct users as much as possible to the IASC Common M&E framework, which is sort of like in the understanding and assumption that that's a clear reference for the MHPSS community, in particular in terms of M&E. So we wanted to have very clear alignment there. And in particular, this goes in terms of selecting and adapting means of verification. So as you know, as Alison presented, the IASC Common Framework has provided very structured toolkit and very helpful toolkit in terms of means of verification that is pretty useful in making decisions in terms of measurement. And also we have adapted the direct users in our framework for guidance on measuring improvement in domains of mental health and psychosocial well-being. And we will see some examples about this. This is an example of a small piece of the UNICEF MHPSS log frame. And in here, you can see a little bit of the structure. We have the outcomes on top. So you can see outcome number 1. UNICEF's outcome is improving child and adolescent mental health and psychosocial well-being, which is also adapted from the framework in particular. Then we have gone ahead and elaborate intermediate outcomes and outputs related to these specific outcomes, and develop and propose some specific indicators. But then what you can see on the right-hand side, the other yellow highlight is we're referring in terms of verification. We're referring our UNICEF audience, or which is also intended to be for more broadly used, to the M&E framework for means of verification. So we want to make sure that there's alignment, there's harmonization of references and sources, and that the community also benefits from references and instead of providing information that could potentially be confusing. So for us, this alignment with the IASC has been very important in the production of this reference. I think I can go back to you, Zeinab.
Thank you. Thank you, Liliana. So now we move on to the second part of the session, through which we bring you a case study that will be the foundation for an application exercise. The case study is from UNICEF's work in Kazakhstan, which has one of the highest suicide rates among adolescents worldwide. The case study describes MHPSS interventions to accelerate and scale support for adolescents at risk of mental health problems and suicide, a model that is now operating throughout the country. In brief, the programming includes the launch of a platform for individual online counseling services for adolescents, along with training and education for mental health specialists in the face, in the face of anxiety, stress, and uncertainty brought on by COVID-19. The project resulted in 5,000 school psychologists and mental health professionals who were trained over the life of the project. And this is an example of a pilot program that was taken to scale across 450 schools nationwide, and has showcased important impacts that were defined through a slow decline of suicide rates among adolescents. Next slide, please. So let's recap quickly. The program in Afghanistan aimed to improve mental health and prevent suicides in adolescents through workforce development and reducing stigma around suicide, mental ill health, and services. The program included key intervention strategies across the enabling environment, as well as direct service provision to adolescents in need of MHPSS services. So these included working closely with government to improve policies and legislation that was necessary to remove the barriers to adolescents accessing services, ensuring the program was rooted in research and data specific to adolescent mental health in Kazakhstan, strengthening multi-sectoral systems and referral pathways, primarily between health and education sectors, and ensuring at-risk adolescents accessing school-based MHPSS services, including case management, strengthening workforce capacity through school-based psychologists and primary healthcare providers to deliver mental health services, and finally, addressing stigma around suicide and mental health services through community-based awareness campaigns and activities. Next slide, please. So as we progress with this exercise, what we will do is we will present activities from the project and utilize the IASC M&E framework to establish corresponding activity outcomes, indicators, and means of verification. But first, over to Liliana to cover some key terms. Yeah.
Thank you, Zeinab. So at the risk of being repetitive, we wanted to provide here some of the main definitions that we're going to use to make the activity, to have some more common ground in terms of the activity. And I'm saying repetitive because Alison in the main presentation gave us some of these definitions. So as the activity will be about identifying outcomes, indicators, and means of verification, as Zeinab mentioned, we wanted to keep them here first. And so we just refresh our minds about this. As you know, in the field of M&E, there's a lot of confusion among practitioners and people working on this in terms of what is an outcome, what is an output, what is an impact even. So let us just review this together. So impact, for impact, we're referring here to the results at the level of a goal. For outcomes, we're talking about the changes that occur as a consequence of a specific project's activity. So changes as a result of the specific activity, and results at this level are commonly referred to as project outcomes. For indicators, we're looking at the unit of measurement that specifies what is to be measured, right? Very straightforward. And it can be quantitative or qualitative. Quantitative in terms of percentages, numbers of, or qualitative in terms of perceptions, quality, knowledge gain. And then last but not least, means of verifications, which is also known as measures or data collection tools or even sources. These are the tools used to measure the indicators, and these vary widely across countries, across settings. So we're going to go over some examples here. As you know, if you're familiar with the report and the product that is launched today, there is a very rich interactive tool that allows us to go over all the tools and means of verification that the IASC M&E framework is suggesting, and learn and make decisions about that. So we're going to go about that in a few seconds. So we're going to have some interactivity here. So I will ask you to, I'm going to paste this in the chat box. And when we go over the exercise, please have it ready, and either on your phone or on your computer, please enter this site, because on the 4 activities that we're going to go over, we're going to make decisions there. We're going to hear from you through that link. It's called Meeting Polls, and let me just go off presentation mode to paste this in the chat box.
I have done it, Liliana, no worries. Yeah.
Oh, perfect, thank you. Yeah, please go and to the chat box, grab the link and open it either on your computer or your phone. And no need to spend time there yet. We will let you know where to go. And Zeinab, can you also please paste? Oh no, I can paste the link to this report for your activity. So we have all the links that we need for the activity at hand, right?
Would you like me to do it quickly?
I just did. So yeah, that's good. So let me go back to your presentation mode, and then you can continue.
Okay. Great. Thank you so much, Liliana. As mentioned, now we're moving into this exercise. And so the survey link that was shared will have 4 separate surveys. Each one will be made available to you once an activity of the Kazakhstan project is presented, and you are then guided to utilize the M&E framework and toolkit to select corresponding activity, outcome, indicator, or means of verification. So let's begin with activity number 1. So an important activity that the project implemented through strengthening MHPSS integration in schools is facilitating access to and the receipt of counseling and case management services for those adolescents who are identified as being at risk for mental health problems, including suicide. So if you can, please refer to the outcomes in the IASC M&E framework, and you will find this on pages 19 through 22, and take a minute to select the outcome that you feel corresponds best to this activity. You can access the Meeting Pulse survey, the link that we shared earlier, to cast your vote. You have 1 minute to complete this survey question. And I am copying the IASC framework, or you might have done this already, Liliana. Yes, you have.
Yeah, it's there. The link is there. I'm gonna also on the screen, I'm gonna share like the first screen from the framework where we have the 4 outcomes. So that just to share that view as
And
well.
if you're familiar with the framework outcomes, you know, we have an outcome that looks at emergency responses not causing harm. We have an outcome that looks at people being safe and protected and their human rights addressed, human rights violations addressed. We have an outcome that is focused on family, community, and social structures that promote well-being and development. We have an outcome that looks at communities and families supporting people with mental health and psychosocial problems. And we have an outcome around people with mental health and psychosocial problems who are using appropriate focused care. So with this activity in mind that is focused on the counseling and case management services for adolescents, please choose the outcome that you feel corresponds best to this activity.
So I have shifted the screen to present the voting, the poll, in which colleagues have already started to share their views about what's the most relevant outcome. I see we have 24 people online, and we see the voting happening. We're giving about a minute, and then we will go over the results.
Yep. Yes, that's correct. You get to choose only one, the most appropriate.
Zeinab, can you see the screen correctly? The
Yes.
voting? Okay.
Yes. Right. So as you can see, this exercise is not only meant to kind of engage you around the activity and the selection of the outcome, but also to familiarize you with the monitoring and evaluation framework itself and to kind of help you navigate through its components. So with that, I mean, as noted, and as you rightfully selected through the survey, the outcome that is most relevant to this activity is indeed the outcome around people with mental health and psychosocial problems using appropriate focused care. And as you sift through the framework, you will also establish indicators under this outcome that correspond best to this activity. We will not have a survey around this, but for your information, the most relevant ones would be outcome 5, indicator 4, that looks at the number of women, men, girls, and boys who received focused psychosocial and psychological care. And then indicator 05.6, so the indicator 6 under outcome 5, that look at the number of people who are part of an at-risk group receiving focused care, such as psychological first aid, linking persons with psychosocial problems to resources and services, case management, psychological counseling, and so on. So you might also, in your kind of navigation of the framework, also seek to kind of look through the indicators to also validate your selection of the appropriate outcome. And as mentioned previously, an effective meal system looks at impact, which can be measured through relevant means of verification. For this activity, and if you take a look at the IASC M&E toolkit on mhpss.net, this might include specific measures within the domains of functioning, social connectedness, among others. The selection of these domains and relevant tools will be dependent on your impact indicator and assessed for appropriateness to the local language, age, culture, and context. We will go through another activity where you are asked to kind of select MOVs, but we will not be doing it for this specific activity. Liliana, and for the, yes, and then there's this slide as well. And you can see here, in the beginning, we talked a little bit about how, you know, UNICEF institutional framework was informed by the IASC document. And these are the actual outcome indicators and MOVs that were selected by the MHPSS program managers to ensure appropriate monitoring and evaluation of this activity. And so you'll find that the outcome is slightly adapted and reworded to be child and adolescent focused, and indicators fine-tuned and adapted to look specifically at improved domains of mental health and assess help-seeking behavior. Guidance on MOV selection refer back to the IASC framework, but we suggest an additional tool, the map, which we will also share a link with you by end of the presentation, which specifically looks at help-seeking behavior among adolescents. So this is really just an example of how you can utilize the M&E framework to guide your meal system development, but also ensure flexibility that is necessary for project, culture, and context specificities. Liliana, over to you for activity 2.
Thank you, Zeinab. So we're going back to another example from the Kazakhstan project. In this project, one key activity that was promoted was peer-to-peer support groups to support adolescents who need additional support. And so the activity now is going back to the IASC Common M&E Framework, where you just were looking at the different outcomes. And the idea is to identify, this time we want to identify indicators that correspond to this activity, to the activity of peer-to-peer support groups to support adolescents who need additional support. So we want to see what are those indicators in terms of maybe quantitative indicators, percentage of something, number of something, that from this framework we can, you know, utilize to best monitor this activity. I can share the screen again to the framework where those activities are possibly located, and we can look at that together. Sure, hold on a second. Now I'll share the screen to the poll, and then because you have your links open to the M&E framework, so you can go there at pages 20 to 22, try to identify the indicators, and I'm sharing the screen to the poll where you can do the voting. So we are presenting here, for example, indicators that some may apply, some may not, but the idea is that you root through the indicators and identify which one would be most appropriate to measure this activity. Thank you. So we have about 20 people who are online, presumably all of those 25 voted, and we have the results on the screen. These numbers don't lie. So effectively, you see that the two indicators at the bottom had the most voting. So that speaks about, you know, the experience of our, you know, colleagues in the group. Because effectively, for the indicators to measure the peer-to-peer support groups to support adolescents, the most appropriate indicators from the examples are the last two at the bottom. In terms of, we can measure the number of affected people who use social structures, and these can be a variety depending on the setting. This can include schools or informal education for children of all ages, healthcare, social services, early childhood development, women's youth group, youth clubs, can be sports clubs, you know, any sort of social structure that are available in the specific setting. And the second one is also looking at number of members of at-risk groups, such as children or survivors of sexual violence. That one may be particular to, you know, people affected by those specific issues, but definitely it's a population that also needs support, needs additional support from the, you know, available services. Thank you. So that was great to hear from you about this. We go back to the presentation now, and we're going to share the example from the UNICEF framework, in which we also identify from our framework what will be the outcome for this peer-to-peer support activity. And then, as you can see, we have clearly adapted it to children and adolescents who have access to support in clear, harmonization with the IASC framework. And from here, we have included 2 indicators. One, measuring the children, adolescents who are working very closely also in areas of caregiving, which can be teachers or coaches or other sort of, parents or guardians of children and adolescents. And we're trying to measure through this indicator the ones who demonstrate improvement in relevant domains of mental health. And the second indicator is about children and adolescents who, with symptoms of depression and anxiety, measured through other scales that are already also included in the framework, but the ones who are reporting contact with health professionals or counselors. For this, definitely, we are recommending reviewing the IASC Common Framework for the MOVs, and for the specific indicator or MMAP, we are also adding MMAP reference, and MMAP, just for you to know, includes adapted versions of PHQ-9 and GAD-7 for the measures of depression and anxiety. So we're moving on to the activity number 3. And this activity will include also going back to the toolkit, because we're very excited about the interactive toolkit that the IASC has made available. So we want us to go there and take a look together. So going back to the activities from the Kazakhstan project, the activity number 3 is about primary healthcare and school-based psychologists provide individual services to adolescents at risk of mental health problems, including mental health counseling services. So this is our time to explore that very rich toolkit. So let's take a minute to access. Zeinab, can you please paste the link to the toolkit in the chat?
It's in the chat.
Perfect. So let us go to that link that Zeinab pasted. You need to scroll down a little bit until you find these color boxes here. Let us go to the disabling distress symptoms domain. And what we need to vote on this time, once you get there, or vote on after identifying the response, is to identify which subsection your MOV belongs to for this activity. So it's, once you get there, this will make more sense. So go to this box, to disabling distress symptoms, and then you'll find the information for these type of activities. In the meantime, I'm going to share the polling option so that you see more clearly what we mean. So question number 3. Wow, I already see some voting here. So the idea is to identify which subsection your MOV belongs to for this activity. And the activity is primary health care and school-based psychologists provide individual services to adolescents at risk of mental health problems, including counseling. So there are some examples here of what the toolkit is providing. We see some movement. Let's give half a minute more and see what colleagues vote. All right. So in here we have a couple of decision-making elements, right? First, we have the age groups, right? So we see that the question is about adolescents. And adolescents age group can be defined in a slightly different ways across different, areas of work. For example, for UNICEF and WHO, adolescents are defined as young as 10 years of age up to 19 years of age. But this varies. This may vary from 12 to 18 or 13 to 17. In any case, the adolescents, that's the second decade of life, and around that, that's what we're looking at. And for example, from the examples that we see here, and as you might have seen in the toolkit, this is clearly aligned with the options that you found there. We see that the third and fourth, the SAICA, 3 to 6 years, and SAICA 6 to 36 months, would not be of any use. And rightly so, nobody selected them because we're looking at indicators for adolescents. So that was a perfect decision there. And we see how most votes are for like number 2, child psychologist distress scale, child anxiety and depression scale, ARCAT 25, which also includes adolescents, and a strengths and difficulties questionnaire, which is a very well-known scale for distress. So perhaps the alcohol and use disorder identification might be helpful if the issues that adolescents are facing have to do with substance use. But if we don't have that information, perhaps it's best to stick with the other scales that can be more inclusive of other mental health related issues. So thank you for sharing your views about this. Oh, we have 2 more minutes. So Zeinab, back to you. Let me go back to the
Thank you,
Liliana. Slides. So maybe we can skip these. Do you want to skip 4? Okay.
So I think we're being given 5 more minutes, so maybe I'll zoom through it. So this activity really looks at stigma. And as you might be aware, the stigma around mental health in Kazakhstan was and really still is the largest barrier in addressing adolescent mental health and suicide. And so the Kazakhstan project included an activity that was centered around addressing stigma as a key barrier in suicide prevention through developing culturally appropriate materials that were specific to mental health stigma reduction for adolescents and their communities. And so the reason for this activity was clear. Please, you can now refer to the outcomes in the IASC MHPSS framework, pages 19 to 22, and select the outcome that you feel corresponds best to this activity. And these, of course, include outcomes that might or might not be relevant to stigma reduction and awareness raising within the communities. So please access the pulse survey. That's great. I see the responses coming in already. And interestingly, for this specific outcome, and I think this was something that I mentioned earlier as well in the first activity, is that for the selection of the outcome, you might need to explore what that includes and the relevant indicators. And the relevant indicators, for example, for the outcome around communities and families supporting people with mental health and psychosocial problems really does hone in very specifically around perceptions, knowledge, attitudes, including stigma and behaviors of community members, families, and service providers towards people with mental health and psychosocial problems. So while I can absolutely see the how these different outcomes might really all be impacted by community awareness raising activities, we know that advocacy and technical programming really are very well aligned. For this specific activity, the most relevant outcome is indeed the 4th one down, given that the specificities and the indicators within that do focus on attitude, perceptions, and knowledge improvement around mental health services and supporting those with mental health needs. And yeah, won't go through what UNICEF did specifically for that project, but we will share the slides with you so you could also see the alignment with the IASC framework and the MOVs that considered, once again, the domains within the IASC MNE toolkit under social behavior this time. So I think it's really important for you to look at the toolkit, familiarize yourself with the domains, and select the corresponding MOVs and domains for your activity. In this case, you would have been looking at the social behavior domain within the toolkit itself. so I'm so sorry we had to like kind of zip through the last couple of activities, but really hope that you found the exercise from today helpful. In, I think ultimately what our hope was that you would be able to navigate the IASC framework and the supplementary online toolkit. It really is such a critical document that can be used to inform your project and even institutional programming guidance to ensure, oh, there you go. I think I have been.
I think we'll have to leave the room.
Oh,
yeah.
Yes, I thought I was cut off.
Time's up, I think. Yeah, I got
Yes.
Thank you all
a
for
few
your
minutes.
participation.
Yeah.
We'll share the PowerPoint. Yeah.
Okay, thanks, Zeinab and Liliana.